What is ovarian cancer? There are a lot of misconceptions out there about this particular disease, like that maybe sexual activity can affect or even lead to ovarian cancer, which is not true. Or maybe that ovarian cancer is the silent killer only showing symptoms in the last stages, also totally incorrect. To figure out how ovarian cancer actually works, let's zoom in and take a look at how it progresses in the body. For obvious reasons, this is a cancer that only occurs in women because they have organs called ovaries. In the woman's reproductive system, they have ovaries that house the eggs, fallopian tubes where the eggs can meet the sperm, and a uterus where the baby develops. We're going to focus on the ovaries. Let's zoom in a bit. In the ovary, there are a few different kinds of cancers that can occur. A cell becomes cancerous when it begins dividing at a rapid rate, quickly taking over. This can happen in the ovary in a number of places. Cancer in the tissue lining the ovary is called epithelial ovarian cancer. This is the most common. Cancer can also occasionally occur in the germ cells or primitive eggs, but that's a lot more rare than people think. Most of the time, problems really stem from this outside lining. The problem is that cancers can develop in any of the components of the ovary, and they all have different treatments, which makes it kind of tricky. It's like, say you've got 5 different ingredients that make up the ovary. Every single one of those ingredients can get their own different kind of cancer that has to be treated in a different way. The reason people used to call it the silent killer is because most women would show up to the doctor with cancer in the later stages, when it was far outside of the ovary and at that point really difficult to treat. People used to believe, therefore, that early ovarian cancer didn't even have any symptoms. But we've learned that that's wrong. It does have symptoms that could alert you to the disease early on, but the ovaries are just pretty hard to observe accurately, unlike breast cancer or cervical cancer, where you can do a breast exam or a pap smear. The ovaries are kind of small and hard to get to. Currently, ovarian cancer is the 5th leading cause of death in women. The important thing to remember about it, however, is that this kind of cancer has let's call it a legacy. Let's zoom out a bit. If you have a blood test done and you have a BRCA mutation, you are at a seriously increased risk of ovarian cancer. The general population of women has a 1 in 55 lifetime chance of developing it, but a BRCA1 mutation carrier has a 1 in 3 chance. So, people who have a higher risk of ovarian cancer based on the BRCA mutation or a personal history with breast cancer should report any new symptoms of persistent abdominal pain or a change in their bowel habits as soon as possible. As you can see, with ovarian cancer, there's a lot more at stake than just one life. Finding out you have this mutation means an increased risk for you, your daughter, your sister, and your mother. I guess the important thing is, when considering ovarian cancer, you've got to zoom in to understand what's really happening in the body. But it's equally important to zoom out and consider the bigger picture here. If we do both, I think we've got a good chance of beating this thing.